We will now view animation of how the device performs in the surgical setting. Following sterile preparation of the patient, an arteriotomy is performed on the patient's ipsilateral side. A 0.035-inch guide wire is placed in the artery. Introduce the system over the guide wire and advance to the level of the celiac axis. Remove the safety retainer when ready to advance by grasping the slotted proximal end of the retainer and pulling directly away from the main body handle. With the patient in an LAO position, perform an aortogram and mark the appropriate target landing zone of the stent graft. Push the deployment grip forward, letting the inner sheath exit the outer sheath completely. Under fluoroscopy, you will see the stent graft distal fabric radiopaque marker bands about 1 centimeter proximal to the outer sheath. As you advance the stent graft, you will see the middle marker bands spiraling to a line in the desired position along the outer central portion of the greatest curvature of the aorta. Please note this position as shown in the animation. If the middle marker bands do not align in this position, as seen here, bring the stent graft back to the straight portion of the aorta. Holding the stationary grip and under fluoroscopy, visualize the middle marker bands and rotate the deployment grip 1/2 to 2 rotations in either direction to see a response in the middle marker band position. Rotate to the desired position. Do not rotate excessively, as this may cause mal-deployment or non-deployment. Now reposition the device in the target zone. Note the position of the middle marker bands in this arch, which are now aligned correctly. Rotate the controller to the 2 position. Retract the deployment grip to uncover the bare and first covered stents. Make any final longitudinal adjustments by moving the entire system. Continue to retract the deployment grip entirely in one continuous fluid motion, completely uncovering the stent graft. Retract the deployment grip until the leading edge reaches the black circle marker on the proximal main body handle. Unscrew the stainless steel thumb screw on the apex retainer clip and release the bare stent by pulling the apex release grip, marked 3, completely toward the guide wire lure while holding the controller and stainless steel rod firmly.